a CRT device was implanted, cardiac resynchronization. Over a period of 6 months to a year, progressively the heart size started decreasing. The pumping efficiency almost normalized to the extent that after 8 years, we have now changed the battery and he is doing well with just some minimal medications. This new therapy increases the speed at which we do the procedures, makes the procedure shorter. Therefore, the patients prefer to get discharged either the same evening or next day morning instead of staying in the hospital for 2 or 3 days. Patients should concentrate on healthy habits in terms of diet, exercise and adequate sleep, compliance to adequate medications, periodic visits to titrate the dosage of the drugs, and over and above that, these patients will be helped by these technological advances.
Imagine feeling breathless just walking to your kitchen or being too exhausted to play with your grandchildren. Now this is a reality for millions living with heart failure. But what if there was a way to not just manage but revolutionize heart failure care? Today we are uncovering groundbreaking advancements, conduction system pacing that are changing lives. Joining us at this panel is Dr. Narasimhan, a pioneer in cardiac electrophysiology from AIG Hospitals, Hyderabad. Hello and a very warm welcome to this very special episode of ET Health World present Improving Outcomes in the Heart Failure Care, where we bring you the latest in healthcare innovation. Now today we are diving into the topic that's close to many hearts, heart failure care. With us is Dr. Narasimhan, Director of Arrhythmia and Electrophysiology Services at AIG Hospitals, Hyderabad. So thank you so much for joining us today for this episode.
Thank you.
Sir, we are here to discuss about the heart failure care. These issues have been rising rapidly. What is heart failure? If I want to start with, to set the context for our audience, what is heart failure and why is it such a pressing health issue globally?
So, heart failure generally means that the heart, which was pumping very effectively, the pump becomes weak. So, you see in your house, there is a water pump which is a new water pump which is ejecting water very rapidly compared to a rusted pump. At the end of the life, each time it pumps out very little water. So, when the heart fails, the efficiency comes down. So, instead of briskly contracting, it contracts very weakly. Therefore, the amount of blood that it pushes out to the rest of the body comes down. So, normally each squeeze of the heart is supposed to push about 70 to 80 ml of blood. As the pumping efficiency comes down, it starts coming to 50, 40, 30 ml. With the result, the rest of the organs like kidney, brain, they don't receive enough blood flow, and that is called as heart failure.
On that note, sir, we have heard a lot about the traditional treatments like cardiac resynchronization therapy, right? So how does that therapy work? And the second question would be, are there any limitations? If yes, then what are those limitations?
Cardiac resynchronization therapy is a really a game changer in the field of heart failure. For example, several patients in the past, when they develop heart failure, they progressively worsen only to succumb, or they go for a heart transplant, which is a definitive treatment. And approximately a third of the patients out of 100, 30% of them have a condition called a left bundle branch block, where the heart, instead of beating together, it becomes very dysynchronous. And in those 30% of the patients, putting an additional pacing lead in the left ventricle improves the efficiency. Therefore, these patients are taken out of heart transplant list, their heart failure starts improving, the pumping efficiency becomes practically normal in some of them, and therefore, the heart failure becomes more a success story in those patients. Now, the limitations is, unfortunately only 30% of patients with heart failure are eligible for this therapy, and a vast majority may not be eligible for this. We need to rely on medical therapy for them. The second thing is, even when they are eligible, some of them cannot afford because these are expensive therapies. We try to choose our patients to optimize the outcome.
Yeah. On that note, sir, I've also heard about conduction system pacing, right? So what is conduction system pacing and how is it sort of different from the traditional pacing methods?
So traditionally, the pacemakers, we used to put a pacing wire which comes from the under the collarbone. It goes and paces a structure called as the right ventricle. That is, whenever your heart rate comes down, these patients will need an extra electrical impulse to bring up the heart rate to the desired level. So when the heart rate comes to 20s and 30s, it's not sustainable for life. Patients will succumb. In those situations, there's an electrical impulse which is delivered to the right ventricle at a rate of about 60 or 70 beats per minute. Traditionally, for several decades, this wire used to be placed in the apex of the right ventricle, right lower chamber of the heart. Even though this was effective in increasing the heart rate, the pumping efficiency sometimes gets compromised. So, the newer development is to directly put the lead where the normal electrical wiring goes through the heart, that is called a left bundle. Therefore, it makes it more physiological, more akin to what is in nature, and this does not disrupt the sequence of activation. Therefore, it not only improves the heart rate, it also improves the pumping efficiency.
All right. On that note, can you, sir, share some real life examples of patients who have been benefited by this method?
Absolutely, because we have, for example, a patient who had raised some amount for a heart transplant because he was not improving, young person from Vizag, progressively worsening heart failure, didn't improve with medical therapy, pulled up his resources, worked up for a heart transplant. At that stage, he came for assessment. When we saw that he had this left bundle branch block, a CRT device was implanted, cardiac resynchronization. Over a period of 6 months to a year, progressively the heart size started decreasing. The pumping efficiency almost normalized to the extent that after 8 years, we have now changed the battery and he is doing well with just some minimal medications. That's a dramatic example that we have seen. We have several such patients where out of 100 patients where you implant a device, roughly 30 to 40% of them are called super responders. They become such good response that the heart size shrinks to a normal size and the efficiency becomes normal, that's super responder. The other 60% will have some degree of response and it's highly variable.
On that note, doctor, as we are now moving towards the end of this conversation and we have actually understood a lot of terms and you've explained it beautifully in a layman's language, what's your final message to the viewers about these advancements and also about the importance of personalized heart care?
So, it's for viewers who have any cardiac condition, try to take care of your health. Fundamentally, lifestyle is the pillar of your future health. You need to, despite whatever we do in medical terms, cardiac resynchronization therapy, conduction system pacing, and we do atrial fibrillation ablation very effectively with great success rate. But at the end of the day, if the patient doesn't take care of his health, for example, you continue to smoke, you have alcohol, you have very poor dietary habits, you're going to come back with another set of problems. So, the benefit of therapy will be much greater only if the patient changes the lifestyle. So, they are not mutually exclusive. Patients should concentrate on healthy habits in terms of diet, exercise and adequate sleep, compliance to adequate medications, periodic visits to titrate the dosage of the drugs, and over and above that, these patients will be helped by these technological advances.
Thank you so much, doctor, for being a part of this conversation with us.
Thank you so much.
And you know, it's going to be really interesting and really important conversation for all our viewers, because as we have seen that, you know, such cases are increasing rapidly, both globally and in India. Well, thank you so much.
Moreover, in India, what we find is these diseases, unlike the West, tends to occur at a little younger age.
Yeah.
So patients tend to suffer from these serious ailments at the prime of their life.
Yeah.
When the caregiver suffers, the whole family suffers.
Yeah. No, absolutely. And on that note, I would like to end this conversation, Dr. Narasimhan, and it's surely a message for our viewers to take care of their hearts and take more personalized heart care from now. Thank you so much.
Thank you so much.